Hi all, welcome back to another video. Today we are going to see about cirrhosis. Cirrhosis is extensive scarring of the liver. Portal and periportal areas of the liver are primarily involved, affecting the liver's ability to handle the flow of bile. The development of new bile channels causes an overgrowth of tissue and liver scarring or enlargement. Jaundice is often the result. Common risk factors are alcohol abuse, chronic viral hepatitis, hepatitis B, C, or D, autoimmune hepatitis and destruction of the liver cells by the immune system, steatohepatitis, tender fatty liver disease causing chronic inflammation, damage to the liver caused by drugs, toxins, and other infections. Chronic biliary cirrhosis due to bile duct obstruction, bile stasis, hepatic fibrosis. Cardiac cirrhosis resulting from severe right heart failure, inducing necrosis and fibrosis due to lack of blood flow. There are three types of cirrhosis. First one is post-necrotic, caused by viral hepatitis or certain medications or toxins. Second type is Lennox, caused by chronic alcoholism. Last type is biliary, caused by chronic biliary obstruction or autoimmune disease. Instruct patient to stay current on immunizations, encourage the client to avoid drinking alcohol, and to engage in an alcohol recovery program. Usually, patient shows fatigue, weight loss, abdominal pain and distension, pruritus, which is itching of skin, confusion or difficulty thinking due to the buildup of waste products in the blood and brain that the liver is unable to get rid of, personality and mentation changes, emotional lability, euphoria and depression. Physical assessment findings are cognitive changes, altered sleep-wake pattern, depression, emotional lability, euphoria. Gastrointestinal bleeding due to enlarged veins, varices develop and burst, causing vomiting and passing of blood in bowel movements. Ascites, bloating or swelling due to fluid buildup in abdomen and legs. Jaundice, yellowing of skin, and icterus, yellowing of the eyes. Physical assessment findings. 1. Petechiae, which is round, pinpoint, red-purple lesions in the body. 2. Ecchymosis, which is large yellow and purple-blue bruises. 3. Nosebleeds, hematemesis melena due to decreased synthesis of prothrombin, deteriorating hepatic function. 4th, palmar erythema, which is redness, warmth of the palms of the hands. 5. Spider angiomas, which is red lesions, vascular in nature, with branches radiating on the nose, cheeks, upper thorax, shoulders, which looks like spider web. Coiturdalis. 6. Dependent peripheral edema of extremities and sacrum. 7th, asterixis, which is liver flapping tremor. 8. Coarse tremor, characterized by rapid non-rhythmic extension and flexion of the wrists and fingers. 9. Fetor hepaticus, called liver breath, fruity or musty odor. Medications, because the metabolism of most medications is dependent upon a functioning liver, general medications are administered sparingly, especially opioids, sedatives, and barbiturates. Diuretics decrease excessive fluid in the body. Beta blocking agent, used for clients who have varices to prevent bleeding. Lactulose, Cefulac, used to promote excretion of ammonia from the body through the stool. Non-absorbable antibiotic can be used in place of lactulose. Surgical managements are liver transplant and paracentesis. Let's see about nursing care. Let's see respiratory status maintenance by monitor oxygen saturation levels and distress. Provide comfort measures to patient by positioning the client to ease respiratory effort. Plasma volume excess and ascites causes respiratory distress. Have the client sit in a chair or elevate the head of the bed to 30 degrees with feet elevated. Let's see about skin integrity. Monitor the client closely for skin breakdown and implement measures to prevent pressure ulcers. Pruritus, which is associated with jaundice, will cause the client to scratch. Encourage washing with cold water and applying lotion to decrease the itching. Let's see how to maintain fluid balance. Monitor the client for signs of fluid volume excess. Keep strict intake and output, obtain daily weights, and assess ascites and peripheral edema. Restrict fluids and sodium if prescribed. Vital signs, monitor vital signs and pain level. Neurological status, to monitor the client for deteriorating. Mental status and dementia consistent with hepatic encephalopathy. Lactulose may need to be given to aid in excretion of ammonia. Nutritional status, high carbohydrate, high protein, moderate fat, and low sodium diet with vitamin. Gastrointestinal status. In the presence of ascites, measure abdominal girth daily over the largest part of the abdomen. Mark the location of tape for consistency. Observe the client for potential bleeding complications. Pain status. Assess the client's pain and administer analgesics and gastrointestinal antispasmodics as needed. Thank you all for watching this video. Please subscribe my channel.